As an Air Force medic, inserting IVs is a major part of my job, whether it's on the ambulance, in the clinic, or on an inpatient ward. Many of my patients don't understand why they need to get an IV or even how they work. So today I'm going to talk about some of the common reasons why people receive IVs and how they work. I'll also demonstrate how to insert an IV and then how to remove it. So first I'm going to talk about why IVs are used and how they work. IVs can be placed for numerous reasons. They can be placed simply for fluid replacement. So if someone is dehydrated, they will most likely need an IV and receive fluids through their IV. Another reason IVs can be placed is for medication administration. And this is very important in a life-threatening situation because medication is absorbed in the body the fastest this way. Another important reason is for a blood transfusion. So whether it be from an accident or a surgery, this is how a patient will get their blood transfused. So this is an IV catheter. They come in different sizes and they're measured by gauges. The gauges vary from 14 gauge to 24 gauge. Now the bigger the gauge number is, the smaller the needle is. This one is 18 gauge, which is most commonly used on adults. So the way it works is there's a little plastic hose that's placed over a needle. And after the needle is inserted into a vein, the catheter is advanced into the vein and the needle is removed. Then after that you can hook up the tubing and receive medications or fluids through it, and all that's left in the arm is this little plastic catheter. No needle is left in the arm, just the catheter. So now that you understand the structure of IVs and how they are used, I'm now going to demonstrate how to insert one. So the first step is to find the best place for the IV to be inserted. Different situations have a factor on this, because if it's an emergency situation, the best place to place an IV is usually the AC, which is right here in your arm. It's the best because it's quick and it's easy. And if the patient is going to be in the hospital for a little bit, they're going to have the IV for more than a few hours, it's better to place the IV in a place that's more convenient for the patient, whether it be on the forearm or even on their hand. So once you figure out general idea of where you want to put the IV, you gather all your supplies. So you'll need a tourniquet, gloves, alcohol, gauze, the catheter, tape, and tubing with the fluid attached. So after you got all that, you're now ready to start. So you apply your tourniquet. Feel around for a good vein. You find a good vein. Okay. Get your alcohol pad, wipe off the area, and then you get your catheter. It's very important before you insert it, you do a quick inspection. Make sure it's all there, make sure it's nice and it's loose and there's no missing pieces or nothing's cracked. So, now that you got your vein, your catheter's all good, all you do is simply insert the needle at about 15 to 30 degree angle. So you insert it into the skin, and up here in the chamber, you'll see blood flow. A little chamber here will collect blood. Once you see that, that means you're in the vein. So from that point, all you do is you simply advance the catheter while removing the needle at the same time. So once you do that, you can disconnect it, put a pressure right above the catheter, because if not, you're going to have a bloody mess. And then you can pull your needle out. After that, you take your tubing and you hook it up to the catheter. Once you do that, you can remove the tourniquet and you can apply some tape. You can tape it down nice and secure, and then you start your fluids and you're good. There's the IV. So now that I've told you how to insert an IV, now I'm going to show you how to remove the catheter. So when the IV is no longer needed, it can be removed. Once again, you want to make sure you have all your supplies. All you need for this part is pretty much a piece of gauze and Band-Aid. So once you have the supplies, and you just make sure that your fluids are shut off. The fluids are off, you got your supplies, take your 2x2 and just kind of place it over the catheter. Make sure you have the 2x2 because if not, you're going to have a bloody mess. Then you just slowly pull out the catheter and hold pressure there. And then you can put a Band-Aid on. So it's very important, after it's done, you have to once again inspect the catheter, make sure there's no missing pieces and it's all there. It's all there, you're good, you can tape it down, and the patient no longer has an IV. So as you can tell, removing the IV is probably the easiest step. So through medical technology is improving every day, but there's still almost always a need for an IV. whether it's an emergency situation or an inpatient environment. It's not an extremely difficult process. So now that you have a better understanding of how an IV works and how it is placed, if in the near future for some reason you need to receive an IV, maybe now you'll be more comfortable and you'll understand the process.